Today I'm going to talk about some of the complications that we can expect after craniosynostosis surgery or during craniosynostosis surgery. Now these complications can be extremely hazardous and very radical in the open cases, whereas in endoscopic cases the number of these complications and the extent of these complications can be less severe. Now some of the common complications that I explain every parent is infection, bleeding, scar and pain. This is therefore common in all surgeries, not only craniosynostosis surgery. But in craniosynostosis, bleeding aspect is even more important because in open craniosynostosis surgery, the child can lose massive amounts of blood and your child might require blood transfusion. What we have seen in our experience is that our endoscopic cases do not require any blood transfusion usually, and our open cases almost always require blood transfusion. Now this is one of the complications to keep in mind, that bleeding can happen after surgery. Another important complication that we all need to know that we call as a CSF leak. Now why does this CSF leak happen? During craniosynostosis surgery, when we manipulate the skull of the child, there might be some tears in the dura. Now dura is the covering of the brain. Sometimes when we manipulate the bones, there might be some tears in the dura which can cause CSF leak. Now this is nothing to be worried about. Usually any of the dural tears that we see during the surgery, we repair it immediately. If in case some small dural tears are left out and there is a CSF leak, we usually manage the child conservatively by just waiting and watching, and usually the CSF leak resolves by itself. Now one more complication which I always explain to the parents is possibility of injury to the brain and the eyes. Now because we are in so close proximity of the brain and the eyes during craniosynostosis surgery, there is a theoretical possibility that there could be some injury to the brain and the eye. This in our experience is extremely rare, almost not seen, but still it is something that we tell you to prepare you in case such a scenario arises. Now these are some of the main complications of craniosynostosis surgery.